Hi everybody. So this is part 3 in the last video for cardiology Pharm, and we're going to pick up where we left off, which was with drugs for hyperlipidemia. So I already went through all of these through bempedoic acid, but new drawings are these omega-3 supplements and orleostat. So we'll start with orleostat. So we have a very large person here. He is eating some Oreos and he's like, I need another Oreo stat. He really likes his Oreos. And so the mechanism of action is that it inhibits intestinal lipase from the stomach and pancreas, which reduces the absorption of fat primarily. And this is a drug primarily for obesity, patients who are obese, which is why he's so large. And adverse effects are flatulence, so he's farting. Fecal incontinence is not shown in the picture, and neither is decreased absorption of your fat-soluble vitamins, which are vitamin A, D, E, and K. Another adverse effect is oily stool. So I have this like footstool here that's kind of black colored for oily looking. And then we have our omega-3 supplements. So this is your icosapent ethyl or Vasipa. So we have a Vespa and for Vasipa. And then we also have fish, flax oil, and prescription omega-3 fatty acids. So this picture here is referencing the Disney movie Luca. If you haven't seen it, it's where these sea monsters, when they're out of the sea, they turn into people and then they race in this race because they really want to ride a Vespa. Okay, or like this little moped thing. So it kind of works for the picture because they're fish. So fish oil, they're sea monsters fish. It reduces triglyceride synthesis and increases lipoprotein lipase activity. And then Vasipa, it inhibits VLDL triglyceride synthesis. So both mechanism of actions are kind of shown here with this rat. If you remember from the previous video, rats are vermin, so VLDL, and they are riding on a tricycle, a triglyceride. And if we pretend that they're racing, this one's he's falling behind, he's being inhibited, he's decreased. And if we think of these little AFib lines here, which I will go through in a second, they're kind of like road spikes that are again going to inhibit the tricycle from winning. So the adverse effects for the fish oil is dyspepsia, taste perversion, because a lot of people burp up fish oil, and then allergic reactions. So just imagine that he has like red spots all over him. And then for Vasipa, we have adverse effects of bleeding. So that's shown here. And then AFib shown with the road spikes, pretend road spikes. So now we're going to shift to drugs for arrhythmias or dysrhythmias. And if you remember, they have a whole bunch of different classes. So this is all one big picture that's broken up into several groups. So this picture is taking place at a nursing home, and this nursing home is having an event outside for all the senior citizens to get out and enjoy the day. And so we'll start up here with our class 1A. And so those drugs include procainamide and NAPA or NAPA. And so the story here is someone brought a race car for the old people to look at. And this dude here, he's like, oh, back in my day, I used to be a pro race car driver too. And everyone's like, Grandpa, shut up. No, you weren't. Like, you're a liar. So I don't know, Grandpa here, he's obsessed with race cars. He thinks he was a pro, but he wasn't, and he has a cane, so that's where the procainamide comes from. And then if you know anything about race cars, Napa Auto Parts is a really big thing, so that's what that's about. And what do these drugs treat? They treat AFib. So if you remember, like I said, Grandpa's a liar, 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 pants on fire. He told a fib, AFib. His cane here is built out of PVC piping, PVC, preventricular contraction, and then ventricular tachycardia or VTAC. So we have a little tack on the ground here. And then he's a guy for GI. So next we'll move on to, oh, and I forgot, sorry. So GI was the adverse effect, and then lupus is another adverse effect, drug-induced lupus. So if you remember that it has the butterfly rash, which is why I drew a butterfly. So then we'll move on to lidocaine. So little granny here. This is a class 1B. She's all by herself. There's no other drugs in this category. She's all by herself. She's kind of lost, but she's got her flashlight with her for some light for lidocaine. And again, she has a cane built out of PVC pipe again. So lidocaine treats PVCs. It also treats SVT, which is supraventricular tachycardia. So I think a superhero. So she's got her cape on. And then NSVT, which is non-sustained ventricular tachycardia. Adverse effects are hypotension, which is abbreviated there as HUN. And so you might think like, oh, HUN, it's okay. It's okay that you're by yourself. And then you have bradycardia and then central nervous system effects. So that's your class 1B. And then we'll move on over here to 1C. So it looks like for our nursing home event today, they have this little theater stage set up, like they're gonna have a performance. And this guy here has fleas, unfortunately, and he thinks that he's a shark. He's using like a theater prop, a shark fin, and so that's why we have flea cane-eyed or flecaneide. So fleas for flea, and he's got his cane. It's not made out of PVC this time because this one doesn't treat PVCs. But he is a liar because he's like, I'm a shark. And we're like, no, you're not. So pants on fire, AFib. This also treats Wolf Parkinson White syndromes, which is why we have the wolf. And in case you didn't get it, propafenone, he's using a theater prop. Adverse effects are central nervous system. They are negative inotropes, which means they decrease contractility. And then flecainide is also causes constipation, and then propafenone causes a metallic taste. Over here, I just want to mention, so that's all of our class 1. We have 1A, 1B, 1C. Now we're going to move on to type 2, type 3, type 4, and then some other atypical. And so I brought up beta blockers here, but we've already gone over them in the previous videos. They are type 2. I just wanted to remind myself that by putting the little beta fish with 2 blocks for blockers, type 2. It treats AFib and PVCs. So then we'll move on to type 3. And so we have our garbage over here. And this trash, it's smelly, it's stinky, it's got a lot of odor for amiodarone. We also have this little soda drink here, so Sodalol. And remember, Sodalol is not a beta blocker, even though it ends in LOL. And then someone was like, just in case they want to film the beautiful fun event at the nursing home, they brought their drone for Dronadorone. This treats AFib and adverse effects of specifically amiodarone. I don't know why I didn't write the other ones, to be honest with you. Anyways, amiodarone has pulmonary fibrosis, hyperthyroidism initially, and then it can cause liver problems, skin, eye, neuropathy, and then if it's prolonged use, it can cause hypothyroidism. And the other, so Sodalol, just because I'm looking at my notes, can cause insomnia. And then the amiodarone, it just says it's similar to amiodarone, but with less effects. So that's super helpful. Moving on to type 4. Again, these are verapamil and diltiazem, which are used for rate control. And the arrows are just because I want you to refer back to my previous pictures. I'm not going to go over them again. And then we have this atypical one, and it's adenosine. And so I drew like a den, like this wolf's den, because he had to come from somewhere, right? This is in the PowerPoint, it just said that this is used for diagnostic purposes, and it causes heart block, chest pain, and wheezing as adverse effects. Then we have atropine, or a trampoline, atropine. And this is a competitive acetylcholine antagonist used with symptomatic bradycardia. And so this is a competitor. He's like a professional gymnast competing on a trampoline, ACH, acetylcholine. And this is the one where we have the stupid mad as a hatter. So he's wearing a hat, blind as a bat, red as a beet, hot as a hair, and dry as a bone. So that's all your adverse effects of dry mouth, tachycardia, altered mental status, vision changes, flushing, feeling hot, things like that. And then we already covered some of the nitrates. Like I already drew nitroprusside, which I just wanted to reiterate it because other nitrates that we didn't talk about are nitroglycerin and amyl nitrate. And also I drew some sorbet for isosorbide. Then we have isosorbide mononitrate, which has 1 spoon, and then dinitrate, which has 2 spoons. And remember the cat, he's saying no because he doesn't want to get wet. And NO is for nitric oxide. The hose is being vasodilated. So nitrates convert nitric oxide. They convert into nitric oxide, which causes vasodilation. And so adverse effects are hypotension, headache, and tachyphylaxis, which is having a decreased response over time of being exposed to this. So if you have a patient who just like keeps taking nitrates, they're not going to work basically after a while. And so going back to this, nitrates are used to treat chest pain, to relieve chest pain or angina. And so is ranazoline. It's also for angina. And so what it does, we have Rango here from that movie. They both start with the same 3 letters. That's why I drew that. And it inhibits sodium influx into the myocytes, which in turn inhibits calcium influx, which then decreases contractility, allows the heart to relax, and relieves chest pain. So Rango here, he was gonna go sit out in the sun on this little beach chair, but then this salt shaker with his calcium bone wanted to fight for some reason. So now he's fighting. But he got really dizzy, nausea, constipation, headache, shown by these little lightning bolts. And then, oh my gosh, I didn't even finish writing it. It's supposed to say prolonged QT interval. And so this is it's supposed to be like a long chair that looks like a heart rhythm. And you can see that there's a really long QT interval right here. So now we're going to move on to antiplatelets. And I'm going to go over the ones that I didn't draw previously first. But I actually, like all the ones that we've already covered in our heme unit, I have separate drawings for already, which I'll go over next. So we have our antiplatelet of Vorapaxar. So before I explain the drawing, I'm just going to read the mechanism of action. It's an oral reversible antagonist of the protease activated receptor 1, or PAR1, expressed on platelets. inhibits thrombin-induced and thrombin receptor agonist peptide, or TRAP, induced platelet aggregation. It's used for coronary artery disease and peripheral artery disease. And again, that basically just means that it's an antiplatelet and it works on PAR and TRAP receptors. So we have this golf, right? Because you want to get PAR when you're golfing. This guy, he's hitting it out of a sand trap. And then normally you yell 4 when you hit the ball. I thought 4 sounded like vor for Vorapaxar, so he's yelling vor and he hits this dude in the head with the golf ball. And if you got hit in the head with a golf ball, you'd probably have some bruising and bleeding, which is what the adverse effects are. We have antithrombotics of bivalirudin and leporudin. So biva, the beginning of that, I just thought was sort of like bevel. So I have like a leprechaun for leporudin, and he's fighting this really giant needle bevel. It binds to thrombin, and just like pretty much all the other antithrombin, antiplatelet, whatever, it causes bleeding and bruising. All right, and then we kind of change gears for a second because I didn't know where else to put these drugs. So fludrocortisone and midodrine are used for orthostatic hypotension, and they are alpha-1 agonists. So anytime I see alpha, I think of an alpha dog. So we have a dog and he's dreaming. He's in the middle of a dream. He's mid-dream. So midodrine. And he's dreaming of some flowers for flora neph. And he's been sleeping so good on his hands that his paws, not his hands. So they have pins and needles. So adverse effects are paresthesia, hypertension, urinary retention, and reflux bradycardia. You can use morphine in a hospital setting. So I have this butterfly that is going through metamorphosis. He's morphing into a butterfly for morphine. This is a vasodilator, and so to help you remember that, just look at this tree branch as it goes from right to left. It's getting bigger, it's dilating, and it's an opioid analgesic. And then we have vasopressin. So this is a vase. It is pressing on this kidney, and it is acting right on the V1 receptor in the vessels. So we have like a vessel here and a vessel here. And it causes vasoconstriction, increases fluid reabsorption in the kidneys through the action on the V2 receptor. And everything else in this picture are adverse effects. So we have abdominal cramps. So there's like some abs drawn on this face, diarrhea, nausea, bronchoconstriction. The plant that is in the vase are like upside down lung bronchioles, chest pain, and then hypersensitivity. So this poop here is really sensitive. His feelings were hurt, and so he's crying. Hypersensitivity. All right, and now I'm going to go over drawings that I did during our heme unit. So it's been a while since I looked at these. But we have our antiplatelet medication. So anything that is in this yellow highlighted area are antiplatelets. So we have an aspen tree for aspirin, because aspen and aspirin sound similar. And it's along a river, and there are these people rowing. And fun fact, the person who sits here at the top, and like when you're on a rowing team, the person who sits at the front, they like yell out commands of when to row. They're called a coxman or a cox. And so that worked out great for aspirin being a irreversible COX-1 and 2 inhibitor. And adverse effects are bleeding and bruising. And then I have a giant horse hoof for clopidogrel, because I think when horses run, it sounds like clop, 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 clop. And this is a irreversible P2Y12 ADP antagonist. And I don't know why, I don't remember why, but I chose to represent the P2Y12 ADP antagonist as this Y-shaped receptor thing. And so you can see it's bound irreversibly to the foot. We have this very proud seagull, or prosser crow, and he's choking on this receptor thing. And so it's an irreversible P2Y12 ADP antagonist. Adverse effects are bleeding and bruising, but this time dyspnea because he's choking on it. And then we have Greg. He was playing some Uno and eating Tic Tacs, and he choked on the Tic Tac. And so Tic, and then Greg, like Greg, Tic Heg Velour. There's a little Y-shaped symbol here. Oh, because the brand name is Brilenta, or like brilliant. So it's the P2Y12 ADP antagonist part is shown there. Adverse effects, bleeding, bruising, and dyspnea, because again, he's choking also. And then we have can grelor. So we have a soda can. This time, so the word soda is written, it's flipped, it's reversed, because this one is a reversible P2Y12 ADP antagonist. And it is also an IV medication, and so I just showed that there. Adverse effects, still bleeding and bruising. Then we have our 2B3A inhibitors. And so those are eptidophytide and tirofiban. And so we have a bat, and there's 1, 2 lines on this wing for 2B, and then 1, 2, 3 lines for 3A. Adverse effects are thrombocytopenia, or high platelets. And so we have plate here. And this is another IV medication. So the sharp IV popped the tire. And then we have, so these two that are in pink are specifically drugs for peripheral artery disease. And so we have celestazol or pleatal. And so I thought pleatal sounded like petal. So we have this flower with 3 flower petals coming off of it, and they're labeled 1, 2, 3, or PDE3 inhibitor. And this causes mild vasodilation. And so we have a base for vasodilation. Adverse effects are headache, GI, and bone marrow suppression. And then pentoxifylline. So this is a gymnast. She's very flexible, and she's balancing on a pentagon for pentoxifylline. And the mechanism of action is that it increases the red blood cells flexibility, which is why she's being flexible. Adverse effects are GI, bone marrow suppression, so you can see her bone. And then, oh yeah, this is back when I didn't really establish the difference between like diarrhea and GI. So this, in this picture, it's just GI. It's not necessarily diarrhea. We don't have to know dipyridamole or Agranox for this section, but there they are if you want to look at them. And then we have heparin, or a hairpin, and it binds to antithrombin, inhibits 10A and 2A clotting factors. So I think if you just think of hair as being antithrombin, hairpins, heparin binds to antithrombin, it binds to hair. Again, we have Low molecular weight heparins are a noxaparin. And so in Harry Potter, when they say nox, that's when the light goes out on your wand. So we have a wand here that's broken and bleeding because that's the adverse effects. These also bind to antithrombin. We also have in this category dalteparin. And so I think Dallas, Texas for Dal Tech-parin, Dal, Texas, parin, dalteparin. So not only does it bind to antithrombin, but also inhibits 10A and 2A, causes bruising, bleeding, thrombocytopenia, injection site reactions, which is why there's red dots on here. And you want to monitor renal function. All right, and then we have, I don't think fondaparinux is in this unit, but we did talk about warfarin, so it inhibits the production of vitamin K, clotting factors, yada yada. We have our DOACs, and so when I made these, for some reason I thought that DOAC sounded like the word duck. So I have little ducks that tell you that it's a direct oral anticoagulant. And we have this pixelated picture with a river. So it's pixelated, apixaban, there's rivaroxaban. It's mainly for DVT prophylaxis, works directly on 10A. Yep, that's what's that one. And then we have, I spelled this wrong, dabigatran. And I just thought that sounded like Megatron from Transformers. And the brand name is Pradaxa, or I think of the devil wears Prada. And so this one works on inhibiting 2A. Adverse effects are still bleeding, dyspnea, dyspepsia. And you don't have to know this, but another reason why I drew the shoe on there is because you think devil wears Prada, a daredevil, and I dare you Sizumab, is the reversal agent for this one. For our Gatroban, we have 2 Argyle socks. And so it inhibits 2A, 2 Argyle, Argatroban. Adverse effects are bleeding. And remember, this one is only reserved for heparin-induced thrombocytopenia. Then we have TPA, RPA, and then a new one that we haven't talked about yet was TNK TPA, which was just like a version of the TPA. So it's a modified TPA, has a longer half-life, and it's for the treatment of MI. So we have 2 PAs in a plaza dancing the mambo. So both of these are thrombolytic agents. So thrombo, mambo, and it activates plasmin, which is why they're in a plaza for plasmin. And you can see their PAs because they have little stethoscopes around their neck. And if you look at his arms, like his body, this guy is in the shape of a T for TPA, and her body is in the shape of an R for RPA. Adverse effects are bleeding, shown in a very morbid fountain that is blood. And that concludes, because the rest of these pictures are from heme. So hopefully that was helpful.